I'm doing great. Thank you. Thank you so much. So before you start your session, we will play a video of your introduction. So after that, you can start your session. Have a great day.
Thank you. You too.
Thank you.
Here I am introducing Lucretia L. Cook Williamson. Lucretia L. Cook Williamson, RN, MSN and CPCA, holds a Master of Science in Nursing Informatics from Chamberlain University College of Nursing. Presently, she is a Doctor of Nursing practice student at the Chamberlain University. She has over 19 years of experience as a professional nurse with a primary background in progressive care, telemetry, and medical surgical nursing. She presently specializes in medical coding and clinical documentation with over 10 years of experience. She is president or CEO of the Black Nurses Coalition of Alabama, a non-profit professional nurses organization with a mission to catalyze change through service and health and wellness education in vulnerable communities. She is also a member of the Alabama State Nurses Association, American Academy of Professional Coders, American Nurses Association, Healthcare Information and Management Systems Society, and Sigma Theta 2. This is the introduction of Lucretia L. Cook Williamson. Thank you so much.
Yes, Lakeisha, you can go ahead and you can start your session. Lakeisha, you're on mute.
Sorry about that. Thank you so much. I will share my screen now. It is truly my pleasure to be here at the WYN conference. I have a Master of Science in Nursing Informatics from Chamberlain University. I'm also a Doctor of Nursing practice student at Chamberlain. I've been a nurse for the last 19 years. It is absolutely my passion and the thing that I love to do. My main background was in med-surg, telemetry, and progressive care. But for the last 10 years, I have worked as a certified professional coder and nurse abstractor for a nursing informatics company. One of the things I love most about nursing is how many options we have as far as which direction our professional lives can go in. You know, you might start out as a telemetry nurse and wind up in OR. And
Hi, Lakeisha.
from
Sorry
OR,
to interrupt. Are you playing
you
the
know,
video?
yes, I am.
It is not clear. It is moving so fast.
Okay. I'm also the president and CEO of the Black Nurses I apologize. I'm trying to. Professional nursing organization with a mission to catalyze change. No, I'm sorry. You said that it's playing too fast.
Yes.
Yes. Okay. I will see if I can slow it down.
So can you please play once again so that I can tell you?
Sure. We all know that y'all, the healthcare system continue to evolve and increase the use of artificial intelligence to guide care. Our need for relevant, accurate, timely, and specific care documentation
Your
grows increasingly
your internet is
as
not stable, Lakeisha. It's down. So video is not clear. So yes, it is moving so fast. So can you please, if not, can you please share your recorded session to the contact at the redwinconferences.com?
yes, I can share it.
Please do that.
My apologies for the inconvenience.
No problem, it will happen. Did you share?
Yes.
Okay.
Good afternoon. My name is Lucretia Williamson. It is truly my pleasure to be here at the WYN conference. Thank you. I'm a Master of Science in Nursing Informatics from Chamberlain University. I'm also a Doctor of Nursing Practice student at Chamberlain. I've been a nurse for the last 19 years. It is absolutely my passion and the thing that I love to do. My main background was in med surg, telemetry, and progressive care. But for the last 10 years, I have worked as a certified professional coder and nurse abstractor for a nursing informatics company. One of the things I love most about nursing is how many options we have as far as which direction our professional lives can go in. You know, you might start out as a telemetry nurse and wind up in the OR, and from the OR, you might wind up in research, or there are so many different things that we can do as nurses. And again, that is one of the things I love most is the flexibility and the nimbleness that we have as nurses. I'm also the president and CEO of the Black Nurses Coalition. We are a professional nursing organization with a mission to catalyze change through service and health and wellness education in vulnerable communities. We all know that healthcare is evolving. As healthcare systems continue to evolve and increase the use of artificial intelligence to guide care, our need for relevant, accurate, timely, and specific care documentation grows increasingly important. As providers and clinicians, we understand that good documentation is a cornerstone in providing good quality patient care. Good healthcare decision making is depending upon our ability to access information that is consistent, that's current, and complete in the patient's medical record. Clinical documentation, both good and bad, not only has the potential to impact continuity of care, but it also has the potential to be used in other ways, such as determining clinical reimbursements or being presented as evidence during clinical litigation. And those are just a few of the things that clinical documentation can be used for. Also, the data that's collated and aggregated for clinical documentation is useful in tracking trends related to diagnoses and care outcomes. This presentation aims to bolster the nursing core competency of documentation to ensure that our documentation is consistent, current, and complete in order to facilitate continuity of care and ensure patients, the people that we care for, receive appropriate, high quality patient care. As a nurse coder and auditor, I literally see hundreds of charts each week. Most of the records I see are electronic records, but I do still see the occasional paper record from time to time. That can get interesting, especially if there have been issues with scanning the document into the system. Sometimes you see things like smudging or crinkled pages, and of course, when that happens, that makes the audit process a bit more of a challenge. Despite whether the document is a paper document or an electronic medical record, something I've noticed that many have in common is that basics get missed. And so, what am I talking about when I say basics are getting missed? I'm talking about things like updating allergies, medication reconciliations, um, those types of things, things that we should just be doing with every patient visit, whether it's a known patient or a new patient. There are certain things that we should be addressing with each visit to ensure that the patient is getting the best care possible. Something we can do to mitigate missing some of those basics is remembering those nursing documentation principles that we learn in nursing school. These are standard things that we're taught to document because documentation is not only an essential component of nursing practice, it also has the potential to impact the quality of patient care. And of course, when patients care is impacted, that also impacts patient outcomes. And documentation plays a great role in the care that we're able to provide to our patients. But of course, every decision is based upon the documentation that we see is provided on being able to follow up on the things that were supposed to have been done. So the better documentation that we can make available to each other, the better care we can provide to our patients. The first principle we'll discuss is documentation characteristics. So, documentation should be accessible. It should be available to any person who's providing care to this patient according to their scope of practice. They should have no access to accessing whatever computer system that you're using, or if you have paper documents and you keep them, the records in a particular holding area, they should be accessible when they're needed. Documentation should be accurate, relevant, and consistent. So documentation should be truthful and pertaining to the patient and the issues that the patient is currently experiencing. They should be auditable. So, in other words, I should be able to come in and be able to determine whether or not the care that is being provided is in compliance with standards. It should be clear, concise, and complete. We don't have to have long paragraphs about patient care. We need to have documentation that is clear and to the point and that addresses all of the issues that need to be addressed. It should be readable. So when I say it should be readable, that means it should be legible. And I was speaking earlier about some of the challenges that we have with paper documents. However, electronic medical records can also present challenges with being able to read them too. It's because sometimes the formats are a bit challenging. Sometimes it looks one way when it's in the computer system, but then when it actually translates over into the medical record, it looks entirely different. Sometimes the lettering can be extremely small, sometimes words can be spaced out, sometimes the different areas of the note are not synchronized, and so there's always the potential that there could be an issue with being able to actually read the chart. The last thing that it should be is timely. We should try to document in real time as much as possible. Why do we want to document in real time? So that we are doing things as they happen, and when we document and in real time, it's less likely that we'll forget something of importance. The second principle we'll discuss is education and training for documentation. Documentation is something we learn in nursing school. We learn to document what we did, when we did it, and who we did it to. Those are the main things that we need to learn. Again, what we did, when we did it, who did we do it to? So, in doing that, we also have to be able to combine that with um, the knowledge that we have about the organization's policies and procedures regarding documentation. Because different areas in a facility may have different rules regarding how they document. And some more critical areas in the ICU, maybe you're supposed to document every hour. On a regular med surge floor, maybe you can document every 4 hours. It really just depends. And so it's important to know what your organization's policy is on documentation. Also, we want to make sure that we're being trained in global documentation systems. Computer competence, making sure that people who are accessing your system have a working knowledge of how to access the computer system, how to access the areas that they need. You know, a lot of times we have multiple passwords, we have different areas that we have to access in order to get different pieces of information from the computer record. Also, we also need to make sure that we're proficient in the use of systems that house relevant documentation and healthcare reports, being able to actually go back and look up, say, if the system is different, being able to look at x-ray reports, being able to look at lab values and things of that nature. Our third principle pertains to policies and procedures. So, of course, we want to be familiar with policies and procedures related to documentation. So, again, how often should you be documenting? A lot of times that is decided upon where you are, what department you're in. Again, the ICU, you might document every hour. Depending on where you are in a psych department, you actually might be required to document every 15 minutes. But it's very important to know when to document. What should be being documented? Should you be checking for fall precautions every 2 hours? Are we checking for pain every 2 hours? What should we be documenting? Nursing care and the response to intervention. So, anytime we provide a treatment, a medication, anything of that nature, we should be documenting what the intervention was and the response. We should also be documenting patient education. What did we teach the patient? Um, did we go over their plan of care with them? And if we do have a plan of care, did we document the plan of care? Anytime there is an unexpected event that may transpire, we want to document about that. And most importantly, anytime we have to contact a provider, we want to definitely document that we spoke with a provider and what the outcome of that conversation was. Application of policies and procedures. We want to document according to the facility's policies and procedures. One of the something of importance is that we avoid late entries. Again, when we don't document it in real time, that increases the chance of us forgetting something or missing something of importance. However, if it can't be avoided, if a late entry can't be avoided, make sure to clearly mark the documentation of the late entry along with the appropriate and dated time that the service was provided. And of course, abbreviate according to policy using standard abbreviations to decrease the likelihood of confusion. We want to be very careful about our abbreviations because when we don't, there is the possibility for abbreviations to be mistaken for each other. So we want to be very mindful of that and make sure to use abbreviations that are standards. And then finally, what is the downtime process for where you are? Where are the progress notes? Where are the order sets? What is expected as far as documentation again? Where can you get the information that you need if the computer is down? Where do you go? in order to get lab values, to get x-ray results? Do you run a paper record to use to carry through the downtime process? What's the process for documentation during downtime? Principle number four is in reference to protection systems. So, how are we protecting patient information? Not only patient information, but our own professional information as well within documentation systems. So, for paper charts, one of the primary things we want to do is not leave charts in public areas. So, of course, if you're charting on the hall, you'll want to make sure to take your chart back to the nurse's station and put it in its designated area. We want to be careful not to leave them open in the view of public eyes if we're at a desk. We want to take those things into consideration. In an electronic health record, some of the things that we want to consider is to protect our usernames and passwords. We shouldn't have them written down and stuck to our computer. Want to be mindful of writing them down and taping them to your badge and things of that nature, because if you lose it and someone has access to a station, it's entirely possible that they could use your badge and information to access the patient record. There's no way to know that you weren't the person who actually accessed the record. So we want to be careful about protecting our usernames and passwords. We want to be careful of leaving monitors open. I know in a lot of facilities, the computer system is in the patient room now. So we want to be mindful not to leave computers open with patient information available and accessible when we leave a patient's room. Why? Because sometimes people do access the computer system to read what's in the patient's chart. Not that the patient isn't allowed to know what's in their patient record, but sometimes, if they're in this computer system and they're looking at their record, they may not even be looking at their record. It gives them access to other people's information. And of course, we want to protect everyone's privacy. And then we want to be mindful to only access records that are necessary. So, in other words, if I'm not taking care of Mrs. Jane, then I should not be looking at her patient record. Just as simple as that. We want to protect patients' privacy and their confidentiality. Principle number five: documentation entries should be accurate, valid, and complete. They should be authenticated. That is to say that the documentation should be truthful, with the author clearly identified along with credentials, and nothing has been added or inserted. Also, they should be date and time stamped by the person who created the entry. Again, with late entries, even in electronic medical records, if you make a late entry, it's important to actually notate the actual time that the service was provided in the nurse's note. Even if you did it after the fact, in the nurse's note where you can actually put in a note, you want to make sure to notate when the service actually took place. Also, documentation should be legible. It should be readable. Again, even if it's an electronic medical record, there are still instances where there can be difficulty with reading a note. So we want to make sure that any documentation that we have, any chart documentation system that we use, we want to make sure that we check the notes to see that they are legible once they transfer over into the note from the computer chart, because a lot of times what you see in the computer is entirely different than what you see once that information is transferred over to the patient record. And lastly, we want to make sure that our documentation is made using standardized terminology, and that standardization of terminology also includes acronyms and symbols. We want to make sure that any information in the chart is readily recognized and understood by anyone who happens to look into the medical record and need use of the information. And our final principle is about standardized terminologies. Standardized terminologies are useful when we're talking about aggregating and analyzing data. A lot of the information that we find in documentation can be used to help establish things like evidence based practice. What makes one treatment better than another one? It also helps us to determine when providers or um, organizations are in compliance with with state and federal regulations. Also, it enhances communications amongst the patient care team. So, of course, when we're all speaking the same language, we communicate better, right? When we all speak the same language, that means we all understand each other. Same thing goes for documentation. Standard terms, standard terminology, acronyms, and symbols allow us to better communicate, and it ensures that we're all on the same page with the care that the patient has received and the patient needs in the future. Um, and of course, when we're communicating better, then chances are our patients are going to have improved care, right? And of course, if their care is improved, then hopefully they'll have better outcomes. And lastly, when we use standardized terminology, we're better able to adhere to standards of care because we know what has been done and what we need to do to move forward. So, standardized terminologies have a big impact on the care that we can provide our patients. So now that we've talked about the basic principles of documentation, let's talk about the ways that documentation can be used. So one way that we use documentation is communication. Communication with the patient's direct healthcare team as well as interdisciplinary team. The electronic medical record allows us to share information about patients in real time. It can make a tremendous difference when you're able to see a patient in crisis situation receive care based on the most up to date and current information. So, documentation is critically important in those situations. Another way that documentation is used for credentialing. Patient care documents, process assessments, outcomes measures, all of those things contribute to to performance evaluations of healthcare practitioners and healthcare facilities, compliance with standards of care. And of course, if you're not meeting the standards of care, you're not in compliance and you lose your credentials as providers, that means that we can no longer take care of our patients. And as facilities, that may mean that the facility can no longer provide resources for patients that are actually using their organization for their healthcare needs. That can make a tremendous difference in some areas, especially areas who are challenged with finding healthcare providers. Like, for instance, myself, I live in a rural area. So if our hospital loses its credentials, then a lot of our community won't have access to a hospital. The closest one is roughly 40, 50 miles away. And so if our local hospital loses its credentials and can no longer stay open, then a lot of our folks won't have access to healthcare. So credentialing is extremely important. And another use of documentation is in the court of law. So it's extremely important, again, that we're truthful, that we're concise, that we're to the point in our documentation, because the reality is sometimes things happen. And when they do, our notes can be called into question. And so it's important that the information that we've placed in our charts is relevant, that is truthful, that is concise, that is to the point, and that when we go back to read it, that we are able to recall what we've documented, so that when we're questioned about these things, that we're able to speak with confidence that what we documented is what happened, and we are able to stand by what we documented. Documentation is also used in regulation and legislation. The audits and reports that are created from the data that's aggregated and collated are used to evaluate and improve standards of care, to maintain current standards of care, and or provide evidence of standards of care need modification. They're also used for reimbursement. So when we're documenting, we want to make sure that we are, again, thorough in our documentation, because the documentation is what coders use to determine the severity of the illness, the intensity of the service, and the quality of care, which is what we use to base payments and reimbursements on. So it's, like I said earlier, it's really important that you're thorough in your documentation, because it can actually affect your reimbursement rates. Also, documentation is used for research. The data that can be aggregated from documentation provides information about patient characteristics as well as outcomes. Also, the evaluation and analysis of data is essential in developing evidence-based practice, right, as well as quality healthcare. Lastly, it affects quality, process, and performance improvement. Primary source of evidence used to measure performance. It's our documentation. That's how we determine whether or not the care that we're providing is effective. So that's why it's important when we provide a treatment, we also document the patient response to the treatment. It's also used to analyze variance from established guidelines and measure and improve processes as well as performance related to patient care. And lastly, the data analytics inform the quality improvement activities and the assessment of organizational effectiveness. So again, documentation affects every aspect of patient care, from the provider to the facility. It affects every aspect of patient care. The integrity of our clinical documentation is crucial for ensuring quality of care, continuity of care, and patient safety. This is directly impacts communication and patient safety because poor documentation, and when I say poor documentation, I'm referencing missed and miscommunicated information, inconsistent use of abbreviations, non-standard terminologies. All of those things can lead to adverse events, which and adverse events can include things like readmissions, poor follow-ups after discharge, increased costs associated with care, as well as medication errors, and all of these things can be detrimental to our patients. Also, hospital reimbursements and funding can be affected. How is that possible? Because quality documentation directly impacts coding, and clinical codes provide the data that determines funding and certifications. That's why that's so important. Again, that data aggregation and collation that we've been talking about the entire time, that's why the documentation is so important. Also, surveillance and burden of disease reporting. Why? Because documentation issues, again, inaccurate data, missing data, or misinterpretation of data can result in poor patient outcomes as well. So now that we've talked about principles of documentation and what documentation is used for, I'd like to just touch a little bit on risk management because, again, our documentation can always be used in the court of law for litigation purposes. So, of course, scope of practice varies by education level, licensure, facility policy, and procedure. So, with that being said, there are still some areas that are beneficial in ensuring the facilitation of consistent communication among all healthcare team members. So, some of the things we want to make sure that we document on when we're providing care for our patients is clinical content, things like allergies, current and past medications, over the counter medication, risk assessments, past medical histories, family history, social history, vaccinations, and encounters with their healthcare professionals. These are just a few of the things we want to make sure we document regarding clinical content. Also, any diagnostic tests, referrals, and consultations. When we're doing that, we want to make sure that any abnormal results are relayed to the provider, along with any additional orders that the provider may give us. We want to contact consulting providers, confirm the status of the consult, and any test results that they may be ordering. Also, any additional steps taken to ensure timely patient care. We want to make sure that we're keeping our medications and prescriptions up to date and current. We want to perform a medication reconciliation. Make sure that we've documented what medications the patient is taking, whether or not they're compliant with their medication, or if they need any changes or medication renewals. We want to make sure we ask the patient how they're doing with their meds, if they're having any negative effects related from taking them. Also, we want to make sure that we're documenting any verbalizations about adverse drug reactions or anything like that the patient may be having from their medications. And lastly, we want to make sure that we're documenting when we educate our patients, especially where it pertains to things like informed consent. We want to make sure to document any incidents of patient and family health care education, along with the presence of family members, along with their name. And lastly, the use of any interpreters that may be needed when providing care. Also, we want to make sure to document if there are any barriers to the provision of care. As a reminder, I would just like to say in closing something that we've said throughout the years. If you didn't document it, it didn't happen. Thank you so much for your time. I greatly appreciate you. Have a wonderful day. Hello, are there any questions?
Just giving us 5 minutes. We'll get back with questions. Hi, Krishna.
Hello.
Melinda is facing with some network issues. She will get back us within 2 minutes.
Okay, thank you so much.
Yes, La Krishna. Here is a question from our audience.
Yes, ma'am.
Being a nurse, how did you handle your balance in your work life?
I will be honest with you, it can be quite a challenge sometimes, but honestly, I work on a schedule. So I try to put everything on my calendar and then work according to what I have listed on my calendar. I have a daughter who's in extracurriculars. I'm also in a postgraduate program working on my doctorate. And so I have to be very intentional with my time. A calendar is my best friend.
Thank you for your wonderful answer.
My pleasure.
Thank you for being with us today for this event. I hope you enjoyed this event.
Yes, I have. It's been amazing. Lots of nuggets to take away.
Yeah. Thank you.
Thank you.
Join in the next session, please.
Mhm.